Thank you. So as I said, I'm a UK trainee. I'm looking at the systematic review literature of cystodistension with bladder pain syndrome. As we all know, there is a variability in the technique of performing cystodistension and an international discrepancy of the role of cystodistension in the management of BPS. What we wanted to do was to evaluate the evidence base for the use of cystodistension with particular reference to patient-related outcome measures and draw some conclusions for use in everyday practice. A literature review was performed in October of last year, registered with the Prospero database and performed in accordance to the PRISMA document. There were 59 papers reviewed in total, and after exclusions there were 17, ranging from 1975 to 2016. There were 10 studies that employed cystodistension as a single arm, and 7 used this in combination with other therapies, and as you can see there are just over 800 patients in total. The median follow-up ranged from 1 to 55 months, and in 3 of the studies, they didn't actually include their follow-up regime. Looking at the outcome measures, 10 of these assessed their patients in a subjective manner, and 5 used the O'Leary-Sant symptom score. Looking more closely at the subjective responses, these were very variable and ranged from no difference at all up to 100% positive improvement. Only 11 of the 17 studies actually stated the percentage of female patients, and as would be expected, there were more women. No studies employed a validated outcome measure, and the side effects were very variable and frequent. One patient actually had a bladder perforation during their cystodistension, and one study actually reported a 19% risk of urinary tract infection, along with sepsis, back pain, and epigastric pain. In conclusion, we acknowledge that cystodistension does play a very important role in diagnosing BPS and excluding any other conditions such as bladder cancer. We feel that the quality of evidence available in the literature does fall below a level that we would expect of a new intervention, and for that reason we suggest RCTs or standard international and national guidelines to be made. We also feel that this procedure should be only offered to patients with careful patient counselling, given the lack of high quality evidence and the range of complications. Thank you very much. Does anyone have any questions?
My specialty area is male pain and prostatitis, and the terrible treatment of men for the past 40 years, 50 years is just horrible. And women suffering the same way, it's just equally egregious. And I'm so happy you've done this study. And I just have to ask you, is there something that's just glaring at you that is so utterly absent, something so simple that any of these papers that got published should have included?
Well, the vast majority of them didn't state how they did a cystodistension. So I think the first thing to do would be to actually create some international guidelines on how you do a cystodistension.
And the other part I would add very quickly is an objective data point before cystodistension and after, something so simple.
Yeah, because the
fluid diary. There is not a single fluid diary in any of those papers, and then people will use a visual analog to see what their success rate is. It's just appalling.
It's crazy.
So any questions about that?
Okay.
I hope you will be on an editorial board and not allow any more of those papers to be published unless they have a fluid diary.